Today I'd like to tell you about some of the projects we manage in the Department of Digital Health and Innovation. The role of my team is to get more health messages into more people's lives through more channels, and we do this so that people can make better health decisions and live healthier lives. We strive to get content into people's existing digital journeys instead of dragging them to our channels, so we want to appear in the channels and apps that they consume every day. We work with large tech companies, social media platforms, and through public and private partnerships to reach people. We deliver content into the palms of their hands and in their own language, and I'm pleased to say that we have successfully delivered content to billions of people in hundreds of languages. We focus on three key populations as we plan our digital products. Firstly, the hyper-connected. These are people who have a smartphone or a computer. With nearly half the world's population connected to the internet, the hyper-connected include people in all countries, of all walks of life, and all levels of income. The second population are those which have access to the internet with a smartphone or computer, but struggle to pay for internet connections or data. And the third population are people who do not have access to a smartphone or computer, but are connected to a network of some kind, like with an old telephone and a SIM card. In 2020, we launched over 100 projects, and you may have seen some of these products without knowing that they were WHO initiatives. These projects include hundreds of communication campaigns, such as the Safe Hands Challenge. We've received millions of dollars worth of free advertising space, which enables us to drive 500,000 people a day to our website. And we've worked with policy teams in social media companies to improve their misinformation rules. One of the biggest projects is with Google Search, where we elevate WHO and Ministry of Health content to anyone searching for coronavirus information. More than 300 million people a day see this content. Our free basic service is available in 50 countries and in 8 languages. Through this platform, we've reached some of the poorest communities who are connected to the internet. There's no data cost to access this information thanks to our partnerships with mobile carriers, and nearly 2 million users have already accessed this service. 2020 also saw the launch of our first chatbots with services on WhatsApp, Viber, and Facebook Messenger. Data packages for chatbots are tiny, and therefore this service is extremely affordable. It's a favourite form of communication in low and middle income communities, and more than 15 million people have engaged with us on these channels. To reach those with no access to smartphones or computers, we've launched 2 key projects, a voice messaging service and a text messaging service. The voice messaging service is simply a telephone number that people can call to receive health information. The number is toll-free, so there is no cost to the individual. It's available in 18 countries and in dozens of languages, and the service has been accessed by 20 million people who have listened to more than 250 million minutes of content. Working with telecommunications companies, we have distributed text messages to millions of users. Our goal is to reach more than 300 million people with these text messages containing the latest COVID prevention measures by mid-2021. I hope we have demonstrated that WHO is using the power of digital and mobile to save lives and prevent the ongoing spread of COVID-19. We promote health, we keep the world safe, and we serve the vulnerable.